Should I start, Shivam?
Yes, ma'am.
Okay, a very good evening to all of you and a very warm welcome on behalf of the Counsellor Empowerment Program. This is a presidential program and we are doing one show every month. And today we have a special program lined by our team 3, which includes Dr. Poonam Nair. We are really proud of you, ma'am. And madam's book has been released in the prestigious ESHRE conference. And ma'am, we would like to hear from you about the guidelines just in a bit. I will just give a very brief outline about the program today. And then I hand over to Dr. Poonam, Dr. Shweta, and Dr. Mirambika. So Dr. Pankaj Talwar and Dr. Shweta will be joining us shortly. And today, this is team 3. And there will be introduction and highlights by Dr. Poonam. And madam will also tell us a bit about the guidelines, the very important and prestigious guidelines which madam has presented and has been released in the ESHRE conference. And ma'am, we would like you to share some photographs also later on, if possible, in the group about your ESHRE program and about your book release. And then madam will be talking about counseling and effective communication for information delivery to the couple. This will be followed by taking consent, prognostication, and explanation of the IVF procedure in details by Dr. Shweta Gupta. And followed by this, we will have a very interesting program that will be a case discussion where we will also have a patient who will be logged in, and two very senior counselors, Dr. Poonam Nair and Dr. Mirambika, will be talking about and discussing about the patient. And finally, our young and dynamic Astha, who is the AI expert, and she has developed an app for the support group of the patients, and she will be giving us an update. As you know, in episode 1, we had launched the opening of that release of that app. Today, Astha will be updating us about the progress and the things which are yet to come. So I hand over to Dr. Poonam. Again, ma'am, a very big congratulations to you, and requesting you to please carry on the program.
Okay. So basically, can I share screen now? Just 1 minute. When we are talking about counseling for ART situation, the very most important first step in counseling, we are talking about the very factual information, the information about the treatment, about the injections, about the possible side effects, the outcomes, and so on. Now, this is like a roadmap for the patient. They understand where they are headed, and they may get an idea about how long the treatment will last, what will be the chances of success. And that definitely reduces anxiety. When you have a roadmap, you go anywhere, you are on a flight, and they show you, okay, now you're crossing this, so much distance is covered, so much is left. And it's so basic that knowing, the need to know what's happening. So it's a very fundamental psychological need, first starting point for establishing rapport and beginning
now lock this thing and go there.
Sorry?
All of you go there. I only want one girl. Pallavi ko chhodiye, baki jayega.
So I'll just be sharing some.
Just a minute, Shivam, please mute all others except Dr. Ma'am.
Okay. So I'll just share screen. I have prepared some important points here for just 1 minute. I'll just start from the beginning. It has come on, just give me a minute. Come on, it should first. Okay. So, This is this. Yes.
Yeah, Dr. Poonam ma'am, we can't hear you.
We would like, we lost the connection for a moment. And
Yeah.
okay.
Shivam, please check. We can't hear, and please help ma'am to share the.
So
Hello.
I put it on share. Even if, is it full screen?
Yes, ma'am.
Yes.
Please go ahead.
Okay, now. Okay, so basically, you know, as a counselor, we are
Ma'am, your voice is breaking. Can't hear you.
in sync with looking for emotional issues, but here in the ART situation,
Ma'am, you are not audible.
we need
I think, ma'am, connectivity issue.
Yes, ma'am. Connective internet connection is
Not
low.
good.
muted. Okay, hello, can you hear me now? Well,
Yeah, yeah. No, ma'am, you're not audible. Poor connection.
Even voice is not audible, ma'am. I mean,
Ma'am, can you speak from your phone and just show on this? Or Dr. Shweta can take over and next session.
ma'am, I can present the second part first and then you can keep on
Yeah.
adding or maybe, I don't know how you. Is this visible?
Yes, yes, Shweta.
Hello, ma'am. Dr. Poonam, ma'am. So anyway, let me just start. I'll wait for the madam later on. So we have in today's session, we have 3 members of team 3, Dr. Poonam Nair, myself, Dr. Shweta, and Professor Mirambika. And just quickly, we all know Dr. Poonam Nair is a convener of SIG Counseling and Psychological Support. She has done PhD from PGIMR Chandigarh, and she has been she has recently presented the IFS guidelines on counseling. I'm Dr. Shweta. I'm currently director of IVF at Max and SIG endometriosis convener. We also have Dr. Mirambika with us. She is heading the Department of Social and Behavioral Sciences at National Institute of Health and Family Welfare, Delhi. So what we were supposed to cover these 3-4 aspects in today's session. One was how to provide information, which Dr. Poonam started, but because of the poor connectivity, we could not complete. The second is about the legal consents and documents. And then is how to explain the prognosis or for that particular IVF cycle. And the 12th is how we interact, how we explain the process to the patient, how they, so that the patient can plan and patient can understand the cycle. So the first was providing information to couple, which Dr.
Yes.
Poonam will be.
Ma'am, Shweta is already presenting. Iske baad, you can present from your mobile And if you want to share the slides with Shweta, she can put up the slides and you can speak from your phone. That will be much better, ma'am, because she can. Yes, ma'am. Because
So, ma'am, are you
we
here?
were
Dr.
able to see your
Poonam?
slides, but we were not able to hear.
So, see, it is very important to provide adequate information to the couple, and there are different ways of providing information. One is the verbal explaining, then which should be in a simple language which your patient or the couple can understand. Then there in the OPD, we should have a checklist so that we don't miss out any particular point for a patient. We can also have pamphlets in our clinics so that it visually also the diagrams are there, and which is easier for a couple to understand. We can even have websites and YouTube so that it's easy to understand for the couple. So audio visual help and continuous feedback, because we need to, whatever we are explaining, we have to check with the couple that they are able to understand. If not, we may have to explain 1 or 2 points more in detail. So then I come to the main talk, that's about the consent. And I think we all know that for ART, ART Act was introduced in 2021, and we all the centers are registered under that act, and we all have to follow the guidelines what we have been told by this act. And one of the most important thing is the consent forms. So these consent forms, they are used in all the ART clinics. They are available on the website of the ART. And for each type of the treatment, we have different forms which we must complete it properly and explain each and every aspect. There is because it should be well-informed consent. So every aspect of the consent should be explained. This is a consent form which has to be signed by the couple before the IVF. This is the consent form, which is Form 10 for the freezing. So if we are doing an IVF cycle and we have surplus or we are freezing oocytes or sperm, we must fill up these forms, and which also there is a different separate section for husband and separate for the wife. And also, in case, this is a very important point, that in the unforeseen event of any death, whom would he like or she would like the gametes to go for? Whether it should be handed over to the wife or not, then it should be ticked. So it's very important to explain this first to the couple, check with them that whether they have understood, and then the sign. If they cannot understand English, then it has to be done in Hindi. The next, this is a Form 12, which is the consent for oocyte retrieval. Again, all the name has to be written, clinic address has to be written. Then whatever we are doing, whatever is written in this, it should be explained to the couple. And this is the standard form which Government of India has prepared. So in case if there is any problem medico-legally, then these forms are very important, because they are the documented evidence that you have explained and you have got this signed. This is the consent form for the donor of oocytes. Apart from all the requisites, we must fill up these forms, and the clinic should not do any treatment or procedure without the consent. Written informed consent of all the parties seeking assisted reproduction technology should be there. If there is any donor, the insurance coverage has to be there. The clinics and banks shall not cryopreserve any gamete or embryo without specific instruction or consents in writings from all the parties seeking ART in case of death or incapacity any of the parties. So clear instructions has to be there in the form. And very important is this point, that if any of the commissioning couple may also withdraw his or her consent under. So any time before the human embryo or the gametes are transferred, they also can withdraw. So it is very important that again and again we explain the patient what is the consent for. whether the patient has understood or not, because a lot of time later on, if there is a medical legal problem, then they say, oh, hame to theek se samjhaya hi nahi. So it is very important, explain them, well informed consent, and if any point is not understood, explain it, and preferably, and it should be done in the language they understand. The second point is prognosis. We all know as clinicians and counselors that it is not 100%. IVF is not 100%. So the patient should be counseled beforehand that the prognosis, that this procedure is not 100%. And there are many factors. It's a multifactorial. So many factors impact the success of IVF. It can be the quality of the egg, embryo form, the quality of the sperm, what protocol you have used, whether it's a mild stimulation, whether it's a antagonist protocol, what was the endometrium, whether she had any the endometrium was, that is the inner lining of the womb, was okay, or whether there is a past history of any tuberculosis or any infection, and how easily the procedure of embryo transfer done. The age is very important, so patient cannot have a very unrealistic expectation that she is around 40 and she is thinking that the success rate will be 60%, and especially when we are using her own eggs. So it is very important that we counsel the patient. The more you delay the case, and your aging process affects your egg reserve and indirectly affect the success of the IVF. Lot of patients think that IVF is the last resort and they keep on delaying it. But they must be told that if you delay, then the consequences are on the success rate. So a lot of time patients are told that it's a success rate of particular clinic is very high. So please check with them. It may be cumulative. It may not be one cycle. It may be 2 or 3 cycles. So when we are explaining, we should be very honestly and explain that one cycle may have success rate 30%, 40%, or 50%. As per the international standards, there may be multiple cycles requirement, which may increase the success to 75-80%. If there is a history of gynae problem, tuberculosis, medical condition, the success rate may decrease. So probability is not the actual prediction of success. Sometimes there is an individual response pattern which is unpredictable. We may not be accurately able to predict also, because sometimes the individual body response may vary with the injections. Of course, the patient asks, what can I do? Then the patient, we can tell about the lifestyle changes, about, the healthy diet, BMI, exercise, sometimes taking prenatal. If she has a medical problem, that should be optimized. If she has a thyroid problem, that should be well controlled. Diabetes, her HbA1c should be brought. So these are some of the modifiable factors which is in our hands. There are some factors which are beyond our control. But so this all should be counseled. And sometimes patient has to understand that it may require more than one cycle. So that actually prepares the patient and prevents the high dropout rate after the first cycle, or the psychological depression after the first cycle. The process of IVF. So we sometimes, because we see everyday patients of IVF, we just take them granted that, okay, they know what next to be done. No, each patient has to be told what is IVF, how a month-long treatment will go, what will happen in your first visit, then second visit. The couple should be introduced to the fertility care team also, because it's not one-day treatment. It's a whole month. They come and go, and it's better if they know whom to contact, when, and for what. So a good virtual tour or a guided tour for the clinic should be told right in the beginning, introduced to the team once they have booked for the treatment, and also let them interact. And we should also take a feedback or ask questions if anything is not clear. So we should tell this is a first step of ovarian stimulation. Before that, there may be basic testing. Your file will be made, your consent will be done. Then you will have injections. Then in the lab, there will be fertilization, embryo development, and we select then the best embryo and put it back. Though these are the 5 critical steps, but for patient, it's a whole process which actually takes almost a month, sometimes even longer if we are taking a freezing cycle. So the patient has to be very patient also, because it's not like other treatment. One day you've gone, you paid and you come out, 90% of cases healthy. So this one has to be prepared for that kind of patients also. So every step should be told. So this is what main 3 things as a clinician, very important: explaining the steps, process, then making sure that they have the understood how it will go in a cycle, and also written documented consents. So we also have a case, but I think I will wait for Dr. Poonam ma'am to first. Ma'am, Poonam ma'am.
I've shared the slides with you, Dr. Shweta. Can you share them in the group?
Okay. So,
Mhm.
ma'am, till then, if you want to give your comments, I'll just try to take it out from the WhatsApp.
Okay, yeah, but basically we have talked about giving like a big dose of medical information to the patient. I want to wonder how much of it is received, because in communication there are 2 aspects, the sender and the receiver, and without the proper feedback from both sides, the process of communication breaks down and it remains incomplete. And do you think this this
Ma'am.
information? Hello,
Yeah,
is
ma'am,
it?
you can see now, ma'am.
Yeah, can you hear my voice clearly?
Yes, ma'am,
Yes,
your
ma'am.
voice
Yes,
is
ma'am.
audible. Slides
Okay.
are also nicely visible.
Okay, next. So this is a very important, it's like a roadmap for the patient ahead. Now, for the patient who is not a student of biology, probably maybe of low education or maybe extra Google savvy, So we have to balance out the information. And how can we balance out? The healthcare team knows very well each and everything. So when they talk about AMS and all those technical terms, it just flies over the head of the patient. I've seen patients who would come out of the consultation with the head hanging down, and I asked them, "What's the matter? Are you okay?" And they said, "मैम मेरे को इंग्लिश समझ नहीं आती, मैं हिंदी स्पीकिंग हूँ, मुझे कुछ भी समझ नहीं आया." And the kind of culture we have, the respect to the doctor. They said, okay, if I start asking too much, will they get irritated? The doctors are in a hurry. The team wants to get on. We filled in all the pages, all the diagnostic tests. Okay, now where is the next case? So in that whole process, the subjectivity of the patient is somewhere not connected with. And here, that's what I'd like. I think some one person has to make sure that the patient is understanding. And what is we have the reason, because in terms of data, there is greater well-being, better treatment compliance. And because of this, it can affect the outcome and the patient and the success rates of the clinic. Now, it helps to establish rapport, trust, and a realistic perspective towards art. And on the patient side, he learns to trust you. That trust is so important. We have cases of clinics who report that 5 of my patients with failed cycles got together and put a litigation on the clinic. But I told them everything. They signed the consent forms. So should we do the video recording of the consent signing? I mean, the patient has come with full trust and in full faith. So what happened on the way? probably the breakdown of communication and inadequate patient-specific care, patient-centered care. And believe me, with this case, which actually happened in South India, the judge was in the favor of the patient. He said, the patient ने बोला हम तो बिना पढ़े तो हम साइन कर देते हैं डॉक्टर साहब, जो आप बोलते हैं हम साइन कर देते हैं. And with all the information, with all the consent forms, this woman had to pay a huge amount of litigation with 5 failed cases, which is a normal expected outcome. It was not this thing. It's very demoralizing for the clinician also to face such a situation. So this way in handling information is really important. And the patient should be able to realize that this is a sincere people. They are honest and then they don't have doubts about the commercial exploitation. That they are taking money. Abhi ek test karao, dusra karao. I don't know why. Itne paise bole the, itne extra lag rahe. What's happening? You know. So this clarity has to be there on in terms of giving of information. And here one must remember that each person has their area of specialization and their expertise, and we need to recognize our limits. So what I feel ideally that this whole team can probably reinforce the information given at different steps, where the entire team is involved in the psychosocial care. So, you know, the counselor in UK and all, the counselor sits with the consultant so that they understand the important clinical features regarding each case. Each case is unique. If they should know, they should have a broad outline, the broad knowledge of what is the prognosis, what is the diagnosis, what are the likely investigations required, so that they can it can have a revision lesson or go through it in a stepwise, gradual manner, so that it's you know, it's the can the counselor delivers such a heavy medical knowledge, the broad outline, yes. But and if a question is asked by the patient for which counselor has limited knowledge, they should be honest enough to recognize the boundary. That, okay, here I'm not sure, let me go back to the team, get the clarity and come back. So when a patient asks a question about blastocyst and why they are choosing one embryo or over the other, it would be a good idea to have a meeting with the embryologist who can show them that incubator, who can show that, look, this is what we are doing. We have live you know, cameras where the patient can actually see the blastocyst and which one is getting into the IVF process. So that, you know, the patient says, they take photos, they say, this is the first home of my baby. You know, this is their feelings. When we know that that baby may never come. So this, you know, this kind of personal connection, I think would help the medical team also to be more sensitive towards their emotions, to this little piece of tissue or this gamete or whatever, you know. So another thing is, what should be the mode of delivery? Verbal is one, there should be written handouts. And there's one suggestion which I really like, that every clinic can have an app. In that app, the entire patient data can be stored where the patient can access information regarding their specific condition, so that they are not lost in the Google world, searching this, that, and getting confused and then misleading in terms of their thoughts. So the information has to be at the beginning in the diagnosis. During treatment, there has to be a different type of information reinforced. And after treatment also, there has to be the process of giving. So they have to understand all these aspects, and the counselor cannot provide all the information. That is why all the staff, the embryologist can clarify, the admin staff can clarify certain aspects related with the the timings, the availability of medications and so on, and the record keeping. And when the doctors also, clinicians see that they are heading for a treatment failure, there is a, uh, you can scroll the slide, Shweta.
Yeah.
You can, so this is where, the entire, all staff is involved in providing the information. Next slide. Here, so how do we provide success rate figures? This is a very touchy question because patients, when they come, they are very optimistic. They always overestimate. When you say 40% chance, what does it mean to a patient? How do they interpret it? So this is a very sensitive area. I think it needs to be handled by the counselor, and somewhere at this stage only, the preparation for the end of treatment means maybe there will be a need for gamete, there may be a need for third-party reproduction, maybe there may be a need for surrogacy or getting on with a child-free life, adoption. So all these possibilities may be hinted at or started talking about, so that, no matter how much you say 40%, when the actual failure comes, it's an emotional big hit. If they have other options somewhere fed into their psyche. Hello? So next slide. Next slide, Shweta. So this is, okay, so this is what I think is some of the important aspects. And somebody says background, hello. So there is a very important part of providing information is feedback. Feedback from the patient. And there are questionnaires which have been developed systematically where they ask the patient about the client-centeredness, whether there were words which were used which they didn't understand, whether clarifications were given, and so on, by which you can actually develop an index of how effective your clinic has been in giving good quality care to the patient. I mean, in terms of medical care, it is probably excellent, but in terms of the subjective experience of the patient is something we need to continuously use the feedback coming from the patients. That is a very vital part of the communication process. It's incomplete without it. I mean, I just one small example I had of a clinic I went to, and the clinician told me, she says, my receptionist is excellent, he does everything, but he has anger management issues. And I said, oh my God, now what? And then when I started talking to him, he told me, ma'am, so patients are now, after seeing the clinician, they don't understand much and they come and start asking me, see, what is this? How should I do? When? And he says, I don't have the answers. He's not in sync. So he gets irritated and angry with the patient. And that is where the whole process of rupture happens in the relationship. So that is very, very important to have the information in place before we think of, going any in-depth counseling or specialized psychosocial care. Thank you. Dr. Shweta, we have one photograph also now. We have a photograph.
So, yes, so 1 minute, ma'am, just let me just download. We have also a case discussion.
Yeah.
1 minute, let me take it from your WhatsApp.
We have, I think we can share it later, maybe the case discussion.
Yeah, I just prepare and share. I think till then we can have a case. I'm just going to show one case, and ma'am, you want to introduce the patient as well, and Dr. Mirambika is also with us.
Yeah, Dr. Somati is here with us.
She has a very interesting experience of the IVF treatment, where after 5 years of successive trials and treatment failure, she conceived naturally. And that is, I want you all to hear her story to understand better how we can improve as a clinical healthcare team. Thank you.
So in this the next session, that's a case scenario. We have, apart from Dr. Poonam, we also have Professor Mirambika and a patient. Sumati has kindly agreed to share her view of point how the ART, how did she feel about ART. So just a quick history before we go on to listen from the patient's perspective. Mrs. S, she was 28 years of age and she had been married for 5 years when she came to the ART clinic. And that time she already had one child, normally conceived, delivered normally 4 years old, and she came with a secondary history of secondary infertility for a year. She did not have any medical problems. On routine ultrasound, a fibroid was detected for fertility workup. Otherwise, she did not have any symptoms for the heavy period or pain. She did not have any family or genetic problems in the family. So if we look into her fertility treatment, it was a long duration from 1994 to 99, almost about 5 years she had been going through her treatment. She was first advised fibroid removal, so she had a hysteroscopic fibroid removal. Then she went 3 cycles of IUI and thereafter 2 IVF cycles in a clinic, but all were negative. So that left her very depressed, crying. In fact, she could not even sleep, so she dropped out of the treatment. And luckily, then she worked on herself. She did little bit lifestyle changes, diet, yoga, meditation. And luckily, she conceived naturally in 1999 and then delivered a healthy baby in 2000. So we have here Mrs. Sumati and Professor Mirambika. So over to you both for a session where we all can gain some important inputs. Sumati, can you hear us? Hello? Hello? Dr. Sumati, I think she has joined also, ma'am. Maybe there is
Yeah, she joined right in the beginning. She's here.
Yeah.
Maybe you can unmute her. She's muted.
This admin staff, please unmute Miss Sumati.
Sumati Bachchan. It's even Dr. Mirambika
Professor
needs to be.
Mirambika also, please unmute.
Done,
Yeah,
ma'am.
it's done.
Thank God.
Okay.
Yes.
Right. Yeah, Dr. Sumati, are you there?
Yeah, I'm here.
Okay. So we are really fortunate that you are here. And thank you so much for joining us. So
Thank you, ma'am.
as you already know that, let me just introduce and brief out a bit about her. She is Dr. Sumati, a 59-year-old clinical psychologist. She embarked on an IVF journey from 1994 to 1999, following the birth of her son. Though it unfortunately did not result in success, but Dr. Sumati, your experience is a learning and that can be of immense value to us. And shall we begin?
Yeah, sure.
Okay. So firstly, could you describe your journey over the 5 years and if you can distinguish it into phases as experienced during that time?
Ma'am, my journey of 5 years, initially it was very good and I was very hopeful and very positive. But as the time went, I was feeling little lost because I didn't know where I'm heading towards to. It was very confusing for me and I had very little information about all the entire process. And finally, it was very depressing and I had to leave after 5 years, almost 5 years.
Okay. So, during that time, what kind of family support did you receive? And were the expectation or the gap in terms of role provided by your family and husband? If you can explain.
Yeah, my husband was very, very supportive. He was there for all the in the entire process. He was there with me, and my family was also very supportive. Rather, they were the one who was telling me that you already have a son, and there's no need for going in for IVF and all. But it was our decision to have the second child, and so that was our. That's why we went through IVF.
Okay. Uh, could you share about the support you receive from healthcare providers and also what help you to strengthen the trust with the doctors? What are those factors?
Ma'am, because my doctor who did my IVF was also my gynae who delivered my first child. So for us, it was the first doctor whom we, trusted, and we did go to her for the initial checkups and all after trying for a year or so. And then support, as in medical support, yes, it was totally there, and we completely trusted. There was no doubt of any kind that we did not trust our doctor. She was very capable, very well known doctor at that time. So our complete trust was there in her. But as for the only it was medical support. I mean, the tests, the treatment, the medicines, what she would prescribe, all that was there. But there was nothing apart from that which we received.
Okay. So, did you ever consider changing even your treating doctor, or stopping the treatment altogether?
Not initially, because as I said, we trusted the doctor completely. So the thought of changing the doctor never came to us. And treatment we didn't want because we were halfway down. It was almost 2.5 years. We thought, one more time, let's try one more time. So that's what was happening. And yes, finally, then when we were totally fed up and we wanted to give up, and that was the time when we said, okay, enough is enough. We didn't want to go ahead.
Okay. So, what resources, did you rely on to address your doubts, or were there any myths or misconception you encountered during that time? Because
Um, Ma'am, there was no other support given to us. If I had to ask you any question, because I didn't know what to ask initially. I was not a medical student. I didn't know how the pregnancy, I mean, of course, yes, the basic everyone knows. But apart from that, what is endometriosis, what is lining, what is hormones, you don't know all those details. So I had myself had very little knowledge about it, so I didn't know what to ask her. So whatever the guidance came from my doctor, it was taken as it is. So there was no questions at all. Few questions we would have: how long the process would go, how this will happen. So those were the only thing which were happening.
so, tell me, like in between, if you wanted any kind of help in the sense clarifying your doubts, to whom you would call, and or
My
it was
doctor
unanswered.
Yeah, no, no. She would answer my questions whenever I had. My doctor was the only go-to person. There was no one else. I mean, of course, she had an assistant. There were another doctor. And there were people who were doing ultrasound, etc. But there was no one else. If I would say, if I had my doubts, I can go to this person and clarify my doubts. if I had a counselor, I can go to them and speak to them. There was nothing of that sort at that time.
Okay, probably that was, like long back, almost 10 years back. So the system
Almost
might not have.
24 years back, ma'am, almost 24 years back. So the
Yeah,
counselor also was not there at that time.
yeah. So probably, like what was your path to recovery and resilience?
My path to recovery, I would say, when I finally dropped down from my treatment, I wanted to know how does all this thing work. So I did my own research. I studied a lot. I read about pregnancy. I read about fertility, how it, and I also would like to mention that it was not only after that I left. I also went for my Ayurveda treatment, my homeopathic treatment. I mean, if wherever I would read fertility or pregnancy, I would go and try that out. So that was my case. But by the end of 5 years, I was so totally depressed that I didn't want to do anything. I just studied a lot. I worked on myself. I did my own diet changes, lifestyle changes. I learned yoga. I learned meditation. And I was totally a health freak. I was taking care of my body. I think that body mind thing worked for me very well. My stress level went down. My depression went away. I could sleep better, and I had a very positive mindset, that okay, now let me see what I need to do next with my life. So that was my attitude.
That was really great. And finally, this is the last question probably for today's sessions. So what
Yeah.
suggestion do you have for the couples undergoing IVF, or any feedback, suggestions for AIT clinics or clinicians from your perspective?
Okay, my suggestions for the IVF couples would be that research on your from your own knowledge resources, make a questionnaire, ask the questions, ask your doubts. I mean, if you're going ahead with the IVF, you're paying a hefty amount. You're supposed to know everything which you want to know and get them cleared in first go. And as many times as you want to ask questions, please go ahead and ask the clinicians and get yourself clean, cleared of your doubts. And I feel also that it's the fertility treatment is unlike any other treatment or surgery where you only are looking at the recovery part. Here, you're looking at creating a life, and this is totally based on your relationship, how it will be, your married life will be for future. Because if a couple does not have a child, it may affect their marital life too.
Okay. And tell me, because yesterday when we were discussing that, you said when there was a mood swing and you were under distress, then your husband didn't know how to react. So do you also suggest something, a program or workshop for the husband
Yes, yes, I think the
or the
counseling part
caregivers?
should be, yes, the counseling part should be there from the initial days when a couple walks into the IVF centers. I mean, that's how they should be handled. They should be prepared mentally and emotionally. I think the percentage of positive results would be much higher when the couples are working together with the clinicians. And how to react, the wives that did not know, like in my case, I didn't know why this depression was happening to me, why was I crying so often, why I'm not able to sleep, why I'm getting all those pains all over. So all those things were not addressed. I was psychologically down, and the medicines, I didn't even know at that time that these medicines were also would put you into mood swings. Had I known, I would have been much prepared. And as far as my husband, I didn't know, because he's not a very expressive person. He would keep it to himself. And I didn't know how to react to his emotions or his feelings, what he was feeling inside. Because for me at that time, it was me only, because I was going through it. And had we been counseled properly as a couple or as an individual, we would have dealt with it in a more positive way, and we wouldn't have gone through all this mental torture for sure.
Yeah, we could understand. And thank you so much once again, Dr. Sumati, for sharing your journey and insights with us. And your journey not only, inspire us, but many more across the nation. Thank you so much. And over
Thank
to
you.
Dr. Poonam.
Yeah, so here, what we are seeing is that is why we have the guideline that what is the information? This is guideline tells tells us exactly how the interaction should start, and when we are talking about lifestyle counseling, that should be done before starting the treatment, during the pre-treatment phase. So we are fortunate we have the foundation of huge amount of research from ASHRAE, and using that foundation, we added our own coping
Ma'am, I
mechanism.
think you have two phones or something. It's echoing. Your voice is echoing.
Okay. Okay. All right. Is this clear now? Yeah.
Yeah.
So now, with this, I hope that things, the path of the counseling and the entire healthcare team, as they doing a supportive counseling, not just the medical part, but realizing, like Dr. Sumati said, that you are dealing with the couple, we are dealing with the creation of a child. These are very vital areas of life. It's not like a knee replacement surgery or something like that. So the sensitivity to the emotional aspects of the entire infertility journey and the fertility care, it needs to be there. And we were lucky we had as co-chair Dr. Suveen Guman, and she's got cut off in the photo here. Dr. Sophia Gamiro, it was the convener at ASHRAE Guideline Group. And we had Dr. Anna from Portugal. And of course, here we had Dr. Claire also from Australian Medically Assisted Reproductive Society, which is Aspire. So we are very happy to have released this. And of course, there's so much work done by the core team, Dr. Sweta, Dr. Amita, and there were Karen Jensen also. We had the methodological support from our other team members. So I think this was entirely a group effort. Dr. Ashina was there. Everybody played their role. Otherwise, it was impossible to have done this. And I'm really thankful to the IFS for giving me this opportunity to bring it out and to give me all the support in terms of their expertise. And thank you so much.
So I think Dr. Picky had to rush for some emergency. Dr. Geeta ma'am is here, ma'am. Just few lines from you.
So I will, in the very beginning, wants to congratulate Dr. Poonam Nair. She has done wonderful work. We have got so many, poor ovarian reserve guidelines, poor responders. Now again, the other one for the guideline for the counselor group. Very good. Thank you so much, ma'am, and congratulations to the whole team. And the first the lecture was so good. You have touched nearly all the aspects and really the patient who has occurred. It was so good that Sumati was there with us, and Dr. Virambika has brought it in nice insight. We can do this again and again. Though many patients, they are not ready. Most probably that patient was so much educated and so good. So she agreed. Otherwise, usually the patients are not ready to come to the front. But definitely, if they come, then it is a real good thing. See, because you will all will get the first-hand information. So the lesson learned is Never say never that you will not conceive, never lose the hope. One has to be positive, and here lies, the role of lifestyle, yoga, meditation, all comes together. So that lady succeeded by following a healthy lifestyle, and you could see the result. So it's one principle is never say never and never think that it will never happen. So miracles, usually with all the doctors we have seen, with all the IVF experts they must have got in their life, so many people who you cannot even think that they are going to conceive. And one fine morning you have left, the patient has left, something has happened, the treatment was stopped. And one fine morning they come, they walk in with the baby, and so happy to see them. So this is a beautiful thing, the lessons we are learning slowly and slowly. We can pass on to, as a counselor, we can pass on to our patient that this can happen. So it is not the thing that you should say that it will never happen. So it's after all God gifted. So congratulations, Mirambika, you did a very nice work, and you could bring that patient to us. And she was really very lucky, and we are lucky to find her here also.
Yes, thank you.
So Dr.
Thank
Vicky
you.
has left, I think, for an emergency.
No, ma'am, I'm there on the phone. I'm not able to come on the video. Thank you so
Acha.
much. I think this was a beautiful program, and
Yeah, this
a
was,
lot of new things, lot of
Vicky,
new learning.
the congratulations is to you that with each and every program we are refining. We are going better and better. See?
Yeah.
So
Thank
that
you,
is
ma'am. It's a team effort. And
Yeah.
next time we'll have team 4 headed by you yourself. And we are looking forward to another very engaging program. So I thank you all the viewers and all the faculty, of course, and our mentors, Dr. Poonam and Dr. Geeta and
Vicky,
Dr.
what is the time?
Virambika.
What is the date?
Ma'am, I will share with you after confirming with Dr. Pankaj, sir.
Okay.
Okay, I will be sharing in the group, ma'am.
Yeah.
And we are looking forward to seeing your Nukkad Natak and
Yeah.
the one you are recording in your OPD.
We have
So
so
that
many staff now, and they are all very
Yeah.
talented. Very talented.
Another
Our IVF
innovative
nurse.
approach of yours, ma'am. So every time we are coming up with something new.
So
So
if it is
thank-
possible and it
Yeah.
is enjoying also, let us have
Yeah.
that. Somebody
Yeah.
becomes sas, somebody mother,
Yes,
somebody
yes,
becomes.
ma'am. It is so
Say,
interesting.
yeah. So
And
let us see.
you are anyway the cultural head, ma'am, for IFS. So I'm sure we will have a very entertaining session.
Yeah.
So thanks
meet
to
my
one and
counselor
all.
here. My counselor, Mrs. Madhu Khanna. She's my
Okay,
cousin
hello,
also.
Dr. Muthu.
Yeah.
Acha,
So
very
I
nice.
made her sit down and listen to all these things.
Yeah, next time we will see her participating as well in
Yeah,
the
she will
film.
be participating in that
Yes.
Nukkad Natak also.
Yes, yes. Okay, then. So we close the meeting.
Yeah.
Thank you very much.
Bye.
Okay.
Bye,
Okay,
everyone.
Bye.
bye-bye.
Bye. Nice meeting
Bye.
you all.
Thank
Thank
you.
you. Bye bye.
Bye.